Matt Hancock has said he hopes COVID can be a treatable disease like flu by the health secretary said he is optimistic that the virus, which has claimed 116,287 lives in the UK since the start of the pandemic, can be another illness that we have to live with. Mr. Hancock said that effective treatments and vaccines we can get on with everything. New treatments will be crucial in turning COVID from a pandemic that affects all of our lives into another illness that we have to live with. Like he said, that's where we need to get COVID to over the months to come. And the Tory told the Telegraph, if COVID-19 ends up like flu, so we live our normal lives and we mitigate through vaccines and treatments, then we can get on with that. He said he is confident that all adults will be offered the vaccine by September. Prof Altmann, professor of immunology at Imperial College London, said he agreed with the health secretary's comments about the UK potentially living with coronavirus in the future in the same way as the Professor Altmann told Times Radio, I agree with the by the end of the year part. I think the jury's out on what the future will look like. On news of the number of coronavirus patients in hospitals going down, he said, we're all following the data in the UK and from Israel, who are a little bit ahead of the curve in terms of vaccinations, and seeing those transmission graphs absolutely being quashed. We can't easily pick apart how much of that is lockdown, how much is vaccination, but it's certainly both of those. I am cautiously optimistic that we are winning finally. Earlier today it was reported that COVID hospitalisations are falling faster than expected after England was plunged into lockdown last month, raising hopes lockdown restrictions can be lifted earlier. That documents leaked to the Times reveal the government's SAGE committee expects COVID hospital admissions to halve in the next month. Latest figures show 24,352 people were in hospital with the virus on Wednesday, but it is expected this will fall to around 9,000 by mid. Boris Johnson is set to announce on February 22nd how he plans to bring England out of national lockdown, with schools penciled in to reopen. It is thought this could mean hospitality venues such as pubs could reopen in April if rates continue. But scientists have urged the government not to reopen the country too quickly, with the PM saying he favors a cautious. Nevertheless, with the weekly number of cases falling by more than 26% in 7 days, it has raised hopes that restrictions can be eased. A government source told the my understanding is the Prime Minister is encouraged by a slew of data coming out that shows the positive impact the current locked by March. There's also a good chance that almost, if not all over 50s and younger vulnerable groups would have been given at least their first dose of a vaccine. The optimism is increasing at Downing Street and we may well be enjoying a pint in the pub by Easter if the data continues to improve in the coming weeks. The source also says the government would like to do away with the tier system entirely.